Hello everyone, this is Rahul Best from Delta Healthcare. So in today's session, we are going to discuss about the Roma procedure. Roma is known as routes of medication administration. In routes of medication administration, there are various routes of giving medication. For example, it is intravenous, subcutaneous, intramuscular, or we can say intradermal. So in today's session, we are going to discuss about the intramuscular route with the help of one task trainer, which is known as the deltoid task trainer, or we can say it as IM injection trainer. So before starting this particular session, we are going to discuss about the basic routes of giving intramuscular injection. So intramuscular injection can be given in the different sites, which is known as your deltoid muscles. In the deltoid region, in the buttocks area, there are various routes. For example, if it is a dorsogluteal, ventrogluteal and vastus lectoralis. So these are the specific routes where we are going to administer the IM injection. So whenever we are going to give the IM injection, so we have to approach the patient first. So whenever you are going to the patient size, first we have to do with the hand rub. So what you can do is you can take a 5 ml of a solution of a hand rub and you can start doing the hand rub. The first step is about the palm to palm. Left palm over the right dorsum, right palm over the left dorsum, finger interlacing, finger interlocking, thumb rotation, fingertip rubbing, clockwise, anti-clockwise, and then dry your hands. So whenever you are coming to the patient bedside, first you have to perform the hand rub, then you have to communicate with the patient, because it is a rule of the simulation or the skill lab. Whenever you are approaching your patient, whether it is a mannequin itself, so you have to introduce yourself to the patient, because whether your patient is conscious, unconscious, semi-conscious, you have to introduce yourself. So for example, if it is a patient, so what I do is I have to introduce myself to the patient. For example, good morning sir, myself Rahul, I am the science staff nurse from 8 AM to 2 PM. Sir, may I know your name please? Okay, your name is Mr. Ajay. Your age is 29 years. Okay, so sir, can I check your wristband? Then I have to check the wristband of the patient, because I have to cross confirm whether I am going to give the procedure or the injection to the right patient or not. So the first confirmation is from the verbal contact or verbal communication. Second will be the wristband of the patient, because in the wristband you may able to find the patient name, patient age, as well as the IPD number. Then third confirmation can be from the patient file, where you can able to cross check whether you are going to give the injection to the right patient or not. So you have to cross confirm with the patient file, or we can say it as a non-drug order sheet, and then check the doctor's order, which medication you are going to give, and you have to follow the rights of medication whenever you are going to give the medication to the patient. So approximately earlier it was a 5 rights of medication, but now these are the 10 rights of medication. So rights of medication will take the next class, and then we'll talk about the rights of medication. But ideally now we do have approximately 10 rights of medication. Whenever we are going to give the medication, we have to follow those rights, and then we can administer the medication. So whenever you are going to give the intramuscular injection, so IM injection we used to prefer only 3, 4 or 5 ml, approximately 3 and 5 ml of syringe. Along with this, you need a pair of loose gloves, then you need a medication vial, and then you need some alcohol swab. So first, after the explanation of procedure and after the arrangement of article, now you have to explain the procedure to the patient. For example, okay sir, now I am going to give the IM injection, because doctor has advised me to give this particular medication in your deltoid muscle. So what I'll do is I am going to give this IM injection in your deltoid area. So sir, can I proceed with my procedure? Then after the explanation of procedure, now I am going to arrange my articles, and then I have to give the injection to the patient. So what I'll do is, again I will do the hand rub, because WHO has recommended 5 movements of hand washing. 5 movements, not the steps. Steps are different and movements are different. So WHO has recommended 5 movements of hand washing, and we have to follow those movements whenever you are going to the patient bedside. So initially, in the starting of procedure, you have to perform the hand rub, and whenever you are going to start the procedure after the cross confirmation of patient as well as after the explanation of procedure, then again you have to perform the hand rub, because you are going to give the medication. Then again I am going to perform the hand rub. Then you have to wear the loose gloves, because it is a clean procedure. Roma procedure is basically a clean procedure, no need to use the sterile gloves. Then you you are going to inspect the area. You have to see whether this area is intact or not for the administration of injection. Sometimes you may find some kind of discoloration, or sometimes there may be some wound will be there, so no need to prefer that area. Then you can choose an alternative arm for the injection technique. So for example, this area is intact. Now I can consider this area as the safest area for the administration of the IM injection, as this is a deltoid muscle. So I can give injection within this particular deltoid area. So now what I'll do is, I'll take an alcohol swab and then clean this area from center to periphery. I'll clean this area. Now I'll take the syringe. I'll remove the air from the syringe. Then I will load the medication. And after the loading of medication, what I'll do is, I will load the medication. After loading the medication, suppose it should be admitted. It is approximately 2 ml of medication you are going to administer. Then what you will do is, you will take a 4-finger gaps, because whenever you are going to administer the injection in the deltoid muscle, you have to take a 4-finger gap from the acromion process. So this is known as your acromion process. So you have to take a 4-finger gap, and then you are going to pinch this area while you are going to administer the injection. So what I'll do is, I'll take a 4-finger gap, I'll pinch this area and in 90°, because whenever you are going to administer the iron injection, you have to give the iron injection in the 90° technique. Then you have to insert the needle in 90°, and after the insertion of needle 90°, then what you will do is, you have to slightly pull up the plunger, and in case if you may able to see the blood is coming out in this particular chamber, that means you have given in the incorrect area. If the air bubble is coming out, that means it is in a correct area. So suppose there is no blood is coming out and there is no any specific blood, so but there is an air is coming out from the specific area. So now I am going to give the medication in the slow manner. After the administration of medication, you will take an alcohol swab. Now you have to hold the hub and you are going to remove the needle, and you have to apply the cotton swab over the specific area. But always remember, do not rub the skin. You are not supposed to rub the deltoid area. If you are going to rub that area, then the medication will disperse in the superficial layer. So only you have to take alcohol swab and place it over the specific area to wipe the blood. So this is basically about the IM injection. After giving the injection, now what you have to do is, you have to tell the patient, okay sir, I am done with my procedure. In case if you need any kind of assistance, so what you can do is, there is a call bell in your behind the bed, so you can press the call bell and then I'll be there for your help. Then you have to discard the waste in the biomedical waste management. So you will remove the whole gloves, remove the gloves, and these gloves you are going to discard into the red bin. This sharp needle you will discard into the sharp container, and this plastic one you will discard into the red bin. After discarding the waste, now what you have to do is, again you have to perform the hand rub, because you have done the procedure. So in aftercare you have to perform the hand rub, or you can do hand washing also if you don't prefer hand rub. But in hospital setting we used to be very busy, so we used to perform the hand rub. After doing the hand rub, now you can do documentation in the medication administration record sheet, where you can write what medication you have given, the dosage and the time and the route of the medication administration, and then you can do your signature. So this was all about the intramuscular injection. I hope you like this video. So thank you so much.